Good morning, YouTube. Thanks for watching. This is Dahiya. We've got an amazing video to follow, showing you all the really key highlights of hair transplant, specifically the FUE technique. I think you'll learn a lot and find it fascinating. Thanks again for watching. I wouldn't add further. I mean, we can add a few in here, but let's not go past where we are. Like, this is a really nice hairline already. Get some more density in there specifically. Again, let's not go forward. Good placement, especially the front. I mean, that's nice and low as is. Let's start coming out. Let me just see where we are there. These actually end up looking really nice because they lay on top of each other. Yep. So they give a lot of good density. And this is typically where things, you know, where you'd expect this whole swirl. So here are the hairs. This is, everyone's got kind of a unique pattern here. So there's almost a whirlpool-like effect there in terms of the direction of the hair. So the key here is just matching your existing hair pattern. And we'll blend it into here because this is again where you're at most risk for thinning as we move forward. Like back. And the good news is, you know, you've got such good density of hairs back here.
Here, it just tells us like kind of the metrics here. And then like how many grafts it says we've gotten.
We're starting to get ready by numbing up the donor area for the hair transplant. So one little trick I use is this little vibration device that just basically distracts the nerves. You okay there? Mm-hmm. So lots of little pinches here. But this little vibration seems to help a lot. And as you can see, it's a really wide area we've got to numb up. So once I get this initial kind of circle numbed up, the rest will get a lot easier. It's just these first few that are the toughest here. So this one is about 1 3/4 inches, so it lets us get to sort of a good distance. So I don't have to go in as many spots. You okay? Mm-hmm. A more dilute amount or dilute solution of numbing medicine. The reason we do that is we actually want to create some swelling back here because we're going to spread out the hair follicles. By spreading them out, it's easier to kind of work in between them. Doing great. I know it's a lot of needles here, but we got to get everything really numb, obviously. And up here, well, good. May still need a little bit more up here. How about up here? No. Good. Okay. Oh yeah, definitely that one. There's something right there. Might be a little bit of scar. Oh, there's a little cut there. Almost. Okay, that should do it. Today I want to show you one of the key details of hair transplantation, which is the direction in which the grafts have to go in. So what you'll notice is that hair has different angles throughout the scalp. So on the side here, hairs tend to grow pointed downwards, whereas if you look on top, they're almost perpendicular to the scalp, meaning coming straight up. So what we've done here is made lots of holes, and this is the little punch we used to make them, and I'm going to angle that hole in the direction that I want the graft or the hairs to grow. So the front's pretty straightforward. We've got a bunch of holes that we've made here that are angled straight, and then they flatten out here. Where it gets really interesting and unique for each person is that typically there is what we call a whorl pattern in this part of the scalp, and that simply refers to the fact that hairs, for example, on this part are growing forward. So we're going to make our holes aimed forward. But then as we transition to the front, the angle changes substantially. Here they're angled, again, almost forward. Here they're essentially sideways. So these holes and grafts have to go in at an angle like this. So we're coming in at this point essentially perpendicular to the direction we were before. So following that natural pattern is really, really important to get a nice result. So again, we started out almost perpendicular in this direction towards the right, and then we've straightened, and ever so gently all along this circle we're changing the angle in which these holes are being placed, and you'll see that the hairs now, those little grafts, are following suit. So these hairs are going to point in this direction to match the existing hairs, which you're seeing right there. Those hairs are pointing that way, so we want our grafts to point that way. So that means if I'm going to punch a hole, I'm going to go in that same direction. So here I'm angled, if you look carefully, this hole is angled opposite to what I would be doing here. So here I want my hole to angle literally opposite. I'm going this way versus this way. So just a very important detail of the hair transplant.